Hello everybody, we have a very special guest amongst us here today, Professor Dr. Panikar, who is a consultant, Department of Endocrinology, Diabetes and Metabolism, Leelavati Hospital, ex-Professor of Medicine, KJ Somaya Medical College, Mumbai, ex-Vice President, Research Society for Study of Diabetes in India, past President, College of Physicians and Surgeons of Bombay. He has many publications, research publications, written chapters in textbooks and medicine updates. He has done pioneering work on triple drug therapy, pioglitazone in clinical practice, and he has authored RSSDI guidelines for in-hospital management of diabetes 2016. Welcome, Dr. Panikar. Thank you so much for taking time out for talking to us.
Thank you, Insha, for having me on the show with you.
So today, along with Dr. Panikar, we are going to talk about a topic that I think is on a lot of people's minds, which is weight management. Right, Dr. Panikar? So I would first like to understand what is the current prevalence of obesity in our country?
See, obesity is becoming a huge problem across the world.
Correct.
And our country is no exception to it. And in fact, now you're seeing more and more obesity in children, adolescents, young people. Even the elderly are becoming obese. And it's a huge problem.
Absolutely.
And obesity itself contributes to a lot of problems in these patients. All the non-communicable diseases or chronic diseases are all related to obesity. I mean, obesity in Indians also causes insulin resistance.
Absolutely.
Which put together is the cause for coronary artery disease, heart attacks, paralytic strokes, fatty liver. In females, it can cause PCOS or PCOD, like we call it.
Right.
It can also cause fatty liver and cirrhosis and hepatocellular carcinoma. So it's a big problem.
Correct.
Which everybody is facing. Correct. And it's become a billion-dollar industry to reduce weight today.
Absolutely. Can you tell me, why do you think obesity is on the rise?
What is obesity? It's a basic profit and loss statement of the body. You know, कोई धंधे में प्रॉफिट किसको होता है? जिसकी कमाई ज़्यादा है और खर्चा कम है.
Right.
और प्रॉफिट कहाँ जाता है? बैंक में. So obesity means they are getting more calories than what they really need.
Correct.
And this is what we see in India today is, you have McDonald's, KFC, Vada Pav, Pizza, all the fast foods which were not there a few decades ago. And this is what has changed. So India is going through a situation known as affluence. Food is plenty and high density caloric food is fast food what is the cause of all this. Obesity itself is a major risk factor for all the problems, right from stroke to coronary artery disease to renal failure to PCOS and fatty liver. They are all, obesity is a contributing factor to all of them, including diabetes, of course.
What is the line of treatment for obese people? What would you recommend for obese people?
Basically, obesity it's a profit and loss statement.
Correct.
So if you have a strict diet and an exercise regime which will burn extra calories, that is what will help you in reducing weight. And across the period of time, everybody has tried all this with limited success. And then there were some drugs which came in to help. They were there for a short period, but then they went off the shelf because of potential side effects. Now, currently, we have lifestyle modification, like I just discussed with you. And there are certain drugs which are now available, which are significantly effective in weight reduction. These drugs fall into the category of incretins or incretin mimetics, which is the GLP-1, which has been there now for almost more than 2 decades.
But I feel people have recently started hearing about all
It
this.
has been there for more than 2 decades.
Oh, wow.
But that was what was known as a GLP-1 analog. you had a liraglutide, you had exenatide, you had a dulaglutide, which reduces weight moderately,
Okay.
3-4 kilos in a year,
Okay.
and daily injections, some were weekly injections.
Oh.
But with the advent of semaglutide, which went by the name of Ozempic, which I'm sure is quite
Yes,
popularly known,
absolutely. Everybody's talking about
and
it.
the US FDA approved that as a weight loss drug too. There was significant weight loss with that drug, almost to the tune of 10 to 15%.
Oh wow, that's
Yes.
huge.
But then came another molecule called Tirzepatide, which is popularly known as Mounjaro,
Correct.
which has just been launched a week ago in India. This is a GLP-1 like semaglutide, but it has also a GIP-1. It's a co-agonist. There are
Okay.
two molecules in that,
Okay.
which makes it more effective with lesser side effects.
All right.
In the sense, side effects like nausea, vomiting, loose motion are much less with this compared to Ozempic.
Okay.
And the weight loss is 15 to 20%. And you have another molecule waiting in the wings, going through trials now, yet to be approved by the US FDA, that is retatrutide. You had Ozempic with single molecule GLP-1, you had Mounjaro with two, GLP-1 and GIP, and you have retatrutide, which is a GLP-1, GIP and a glucagon agonist.
Okay.
And there you can get 20 to 25% weight reduction.
Wow, that's really
That
significant.
should come maybe in a year or two.
Okay.
Will hit the
So
market.
that's
Trials
not
are on the
currently.
way, yes.
Can you tell us a little bit more about Mounjaro? That seems to be the most effective
Yes,
weight loss drug
yes,
as of
yes,
now,
yes.
is my understanding. Can you tell us a little bit more about how it works?
In our intestine, we have got certain, I won't say hormones, but there are certain factors like say ghrelin, which is secreted from the stomach. And that is a hormone which makes you feel hungry. If your stomach is empty, ghrelin is secreted and you feel the desire to eat.
Correct.
What this drug does is it suppresses that ghrelin. So the desire to eat is knocked off.
That is more than half the battle won,
Yes.
right?
This drug also has a central action right in the brain, because the brain senses, there is something known as satiety. When you eat something, okay, I'm satisfied. That comes from the brain. This also gives you a feeling of satiety. Plus, there are a few other, the YY proteins and the cholecystokinins, which, will make you sort of reduce your appetite.
Okay.
And that is also increased by Mounjaro.
Okay.
So overall, it works by reducing your desire to eat, reducing your appetite for food. In some patients, there is a small element of nausea,
Okay.
that they don't feel like eating. That's it. But otherwise, this is how this drug works, and it works very well.
That's
In
amazing.
3 months, you could get at least 5 kilos weight loss on an average across the board.
Wow, that's really amazing. And also, not wanting to eat or not feeling the urge to eat is something that I think most people struggle with. So, if we can fix that using something like Mounjaro, that is huge.
Yeah, all the obese people are foodies.
Absolutely.
They love food.
Yeah.
So if you can reduce that,
Yeah.
that's half the battle won.
Yeah, absolutely. Who all can take Mounjaro according to you? Can everybody take it?
Yes, it can be given across the board. Of course, it is not approved for children.
Okay.
But Ozempic is approved for children above 12.
So, what
not
age group can take
Above
Mounjaro?
18.
Above 18.
Above 18.
All right.
There are certain contraindications for it. Anybody who has had a history of pancreatitis, which is a disease affecting the pancreas, which can be an acute problem and a potentially serious problem, they should not be given Mounjaro,
Okay.
because one of the rare side effects is that can cause pancreatitis.
All right.
Yes. There is a condition, familial condition called MEN, multiple endocrine neoplasia, which runs in families, and that can cause a medullary carcinoma of the thyroid.
Okay.
So such patients should not be given. pregnant ladies should not be given.
Okay.
And any of the patients who can't tolerate the drug or who are allergic to the molecule, I mean, you have not to give it to them.
Okay.
Maybe once you have given a shot, you will know he is not comfortable with
Correct.
discontinue it.
Besides that, anybody
But
else can
otherwise,
take it.
across the board, it can be used very
Alright.
safely.
So you would say that it's a safe drug to use, right?
Correct.
Okay, with maybe some side effects, but nothing more
Correct.
than that.
No, even the side effects can be minimized if you titrate the dose slowly. You up titrate it slowly. Start with a 2.5 milligram for 1 month, weekly once for a month. Then you up titrate to 5 milligrams for a month. Then 7.5, 10, 12.5, and 15 is the maximum dose.
Understood. So you slowly understand how tolerant your body is to
Correct,
such drugs
correct,
also, right?
correct.
And then gradually increase your dose. A lot of people are talking about Mounjaro and cancer.
Medullary thyroid carcinoma,
Okay.
which is seen generally in those patients who have a familial background of multiple endocrine neoplasia. In such patients, it is to be avoided.
Okay.
And that's a very rare condition.
All right. Okay. Another myth floating about is that it is more effective on men than women. Is that true?
Yes, there are studies
Yeah.
which show that men respond slightly better than women in terms
Yeah.
of weight reduction.
Yeah.
Probably it's the hormone structure of males compared to females which makes it more effective. That doesn't mean it is ineffective in females.
Okay.
It is equally effective.
So what kind of weight loss reduction are we seeing in women?
Yes, similar to
Similar
males.
similar
I mean, if a male
percentage.
loses 5 kilos, a female would lose 4 kilos.
Okay, so not that much of a
Nothing
difference.
great.
So recently, I have come across a couple of talks on Mounjaro, in which they are talking about Mounjaro paralyzing the stomach. But do you think that's true? Does it actually
That's an
paralyze
over
the stomach?
exaggeration of the function of Mounjaro.
Okay.
All these drugs, all the GLP-1 drugs, whether it is Ozempic or Mounjaro, they delay the gastric emptying. What is gastric emptying? See, whenever we eat something, it goes into the stomach, and then from there it gradually goes into the intestine for
Correct.
absorption. In these cases, that peristaltic movement of the stomach is slowed down.
Okay.
So food remains in the stomach for a greater period of time. So there is fullness, there is satiety, you don't feel hungry, you don't feel like eating.
Wow.
So it is not a paralysis of the stomach, but this is the function of the drug. So nothing to be worried about.
Okay.
There is a corollary to that is, like if suppose some patient has to undergo a gastroscopy to see if he's got ulcer in his stomach, then you should discontinue the drug at least a week before the procedure. Otherwise, he might find food particles there.
Understood. Okay.
But otherwise, no great deal about it.
I feel that when it comes to such drugs, Ozempic is more popular than Mounjaro for some reason.
Because Ozempic has been in the market for much
A long
longer.
time. Correct.
Mounjaro has come in the last year or two in the US market. It has just been launched in India last week.
Right.
So you have a drug which has been there, which was known across the board, but now you have a better drug.
Can you please explain the difference between Ozempic and Mounjaro to us?
See, Ozempic is just a GLP-1 analog. Mounjaro is a GLP-1 analog with a GIP-1 analog. That GIP reduces the side effects of GLP-1.
Okay.
So, molecule to molecule, when you compare Ozempic with Mounjaro, the side effect profile is much less with Mounjaro.
Okay.
The nausea, the vomiting, the gastrointestinal side effects are much less with Mounjaro. That is the basic difference. And the weight loss is greater with Mounjaro because you have a GIP added to it.
Correct. Yeah, so it's definitely far more effective than
Yes,
Ozempic.
yes.
What precautions people should take when they are on Mounjaro?
Why are you taking Mounjaro? To lose weight. Avoid calorie dense food so it will help you faster to reduce weight. This is one aspect. So calorie dense food is all your fast foods and all that. Cut down on them. Oily stuff, cut down. But there is another story to this is that whatever weight loss that you get on Mounjaro or semi or Ozempic for that matter, 30% of that weight loss is your muscle mass loss. So to prevent that, your diet should include more of proteins. And where do you get proteins from? Fish, chicken, that's non-veg. Among the vegetarians, you have pulses which will give you protein. You have paneer which will give you protein. You have soya tofu which will give you protein. Others are hardly any protein content. So you need to have a high protein intake and you need to exercise regularly, where that is where your role will come.
Yeah, so that's exactly what I was about to
Yes.
say, that, I wanted to understand that as a health coach who's been helping people with, their
Correct.
weight management by dietary changes, lifestyle
Yes.
changes, what my role would be,
Your
to
role would be
introduce
to
it
one
them.
is to get them to understand what their aim is.
Understood.
That's weight loss. But at that same time, you want to see that they are fit, that they don't lose their muscle. So your advice for diet would be a high protein diet,
Correct.
less carb diet, regular exercise, and especially resistance exercise, because that is what will keep the muscle intact.
Yeah. Can you please give us some examples on how this drug has worked on different categories of people?
I think that's a very interesting question. Probably I have about 15 patients or 20 patients from abroad who are following up with me,
Wow.
who are doing well, extremely well. To tell you the success stories, like one of the patients, and many of them, especially ladies, in the first month have lost more than 3 kilos.
Oh, that's amazing.
Yes.
And women feel that there's progress is slower.
And one lady, she is about 55, 60. She was on insulin. Her insulin has gone.
Really?
She is most thrilled about it. But this is another injection. But once a week.
That's all right.
That's all right. But I must tell you about this elderly lady who is 65 plus, who was quite obese, who has osteoarthritis of the knees. She could not walk straight, very wobbly walk, very slow, painful, and she had obstructive sleep apnea, for which she was using a CPAP machine. She is on this for last 3 months, and she has reduced more than 10 kilos.
Oh, wow.
Yes.
That's
And
brilliant.
her diabetic medications are practically gone. Her sleep apnea has gone. She doesn't need the machine to sleep anymore.
Oh, wow.
And even her joint pains have gone down, and she is walking very comfortably now.
That's amazing.
Yes, that's
Yeah.
sheer weight loss has made so much of a difference to her that she is thrilled.
Wow. Amazing. See, I feel that when you see your blood reports, or if you feel that your medication is coming down, then that itself is so motivating, to
Yes,
start
yes, yes.
taking something like
And
this,
this
because
patient tells me, Doctor Sahab, kya jadoo kiya tumne? I didn't want to tell her it is not my jadoo, it is Mounjaro's jadoo. But
yeah,
that is the ground reality.
absolutely.
At the same time, I can think of another lady who is now on 15 milligrams of Mounjaro and almost 3-4 months or 5 months, and she has lost only 5 kilos. So, that lifestyle intervention and diet plays a very,
Very
important role in
very
helping them to lose weight.
Absolutely. When it comes to the side effects, a lot of people are concerned about the side effects. In your experience, what is the severity of these side effects?
With the earlier GLP-1 analog, the liraglutide, semaglutide, Ozempic kind of thing, the nausea, vomiting, GI upset is quite significant. And in fact, a large percentage of patients discontinue the treatment because of those side effects.
Okay.
With Mounjaro, that is not true.
Okay.
The amount of nausea or gastrointestinal disturbance is minimal. There is a slight nausea, if at all, slight dyspepsia. Sometimes you could get a slight burning in the stomach, 1 or 2 loose motions. And as the dose escalates, you might see an increase in this.
Okay.
So if it becomes more, all you have to do is de-escalate the dose.
Understood.
Come to a lower dose and the patient will be comfortable.
So, doctor, any interesting patients that you've come across with, any interesting results that you'd like to share with us?
I think I had a very interesting young lady in her 40s who was given Mounjaro, and just took the first dose, and she had severe loose motions, vomiting, could not tolerate. She took leave, stayed at home for 3-4 days. But at the end of 1 week, she had lost 3 kilos weight.
3 kilos in a
Yes.
week? Wow, that's
And
really significant.
I told her, don't take Mounjaro now, wait for some time. She says, no, I will reduce the dose. So, we reduced the dose to 2.5. With that also she was getting. And in that week, she lost another 2 kilos.
Oh, wow.
I said, you stop it, you can't tolerate it. No, I will take 1.25 milligrams.
She didn't want to stop.
She didn't want to stop it. She was so happy that she has lost 5 kilos. She could fit into her earlier dresses, and she claims her skin texture has improved. And
If you see great results, then you yourself are motivated.
And now
to
with
do it.
1.25, don't have a current feedback of what has happened. If she is getting loose motions even with that.
Okay. No, but of course, if you see great results, then you don't want to stop, doing what you're doing. It's excellent.
No, but this is the side effect of this drug.
Yeah.
You can get loose motion. Some patients can get constipation. A little nausea, a little vomiting can be there in a small percentage of patients.
All right.
But across the board, everybody is quite happy with it.
All right.
And I have seen a lot of patients who have lost, say, 2-3 kilos in the first week of starting treatment.
Wow.
And which really motivates them to go ahead further.
Since obesity is such a big issue,
It is.
Anything that can fix it and can fix, people's health is a big deal.
Yes.
So, thank you so much for taking time out to talk to us about this.
Welcome.
It's been a pleasure.
And I think you can help all these patients a great deal.
Yes, I'm hoping
With the
to be able to help them in the right way possible,
Yes.
so that I can make them understand that lifestyle and dietary changes are very important.
Is must.
All right. Thank you so much.